Which of the following condition is an example of acute organic mental disorder? Option A, schizophrenia. Option B, delirium. Option C, mania. Option D, obsessive compulsive disorder. The correct answer is option B, delirium. Organic brain disorder are those which occur due to damage of brain. Delirium is an acute organic mental disorder characterized by impairment of consciousness, disorientation, disturbance in perception, and restlessness. Common forms of delirium are hyperactive, hypoactive, and mixed. In hyperactive, patient is agitated and disoriented. In hypoactive, patient is depressed. In mixed, combination of hypoactive and hyperactive. Schizophrenia is psychiatric condition characterized by delusion and hallucination. Mania is a condition where the patient will experience extreme happiness and high mood elation. Obsessive compulsive disorder is a condition the person will have repeated action followed by obsessive thoughts. A nurse is analyzing the serum laboratory report for a client diagnosed with lung cancer that has metastasized to pelvic bone. Which of the following laboratory finding is expected? Option A, elevated calcium. Option B, elevated creatinine. Option C, decreased hemoglobin. Option D, elevated creatine kinase. The correct answer is option A, elevated calcium. Elevated calcium is the indication of tumor increases the production of calcium from the bone cells. A patient has underwent C5-C6 anterior cervical discectomy. Which priority nursing diagnosis should a nurse document in plan of care of this patient? Option A, potential impaired tissue perfusion. Option B, impaired skin integrity related to surgical incision. Option C, risk for infection. Option D, potential ineffective breathing pattern. The correct answer is option D, potential ineffective breathing pattern. Cervical discectomy is the removal of damaged intravertebral disc, is the treatment of herniated disc and degenerative disc. This will have impact on the nerves underneath the cervical bone. Cervical nerve plays a major role in respiration, so the damage in the cervical nerves lead to respiratory failure. A nurse is assessing a patient who visited OPD with diagnosis of hematological disorder. She noted that the patient has smooth and red tongue and ulcer at the corner of the mouth. Which of the following laboratory finding is most likely in the patient? Option A, low hemoglobin. Option B, elevated RBC. Option B, prolonged prothrombin time. Option D, low white blood cells. The correct answer is option A, low hemoglobin. Low hemoglobin in the blood is anemia. Anemia causes weakness, lethargy, pale skin, ulcer in the corner of the mouth. Increased RBC and decreased WC seen in polycythemia. Prolonged prothrombin time seen in bleeding disorders. A 60-year male patient who had a left total hip replacement was discharged from the hospital 1 month before. He called the nurse reporting acute constant pain in the left groin and hip area and feeling like the left leg is shorter than the right. The nurse advised the client to come to hospital immediately, suspecting which of the following complication? Option A, aseptic loosening of the prosthesis. Option B, deep vein thrombosis. Option C, dislocation of prosthesis. Option D, wound infection. The correct answer is option C, dislocation of the prosthesis. Total hip replacement is the removal of damaged femur head and reaming of damaged acetabulum and replaced with prosthetic components. Indication of total hip replacement are arthritis, damage of hip bone, avascular necrosis of hip bone, and damage of hip joint. Dislocation of prosthesis is the most common side effect of total hip replacement. A nurse is caring for a child with hydronephrosis. Which assessment should a nurse perform to obtain most accurate determination of fluid balance in the child? Option A, measuring the client intake and output. Option B, weighing the client. Option C, assessing for edema. Option D, elevated serum electrolyte level. The correct answer is option B, weighing the client. Hydronephrosis is the swelling of kidney. The most common cause is blockage of urinary tract. Regular weight checking and maintaining intake output chart help to understand the progress of the disease. Alpha fetoprotein or AFP is elevated in which of the following conditions? Option A, omphalocele. Option B, gastroschisis. Option C, Down syndrome. Option D, spina bifida occulta. The correct answer is option D, spina bifida occulta. Spina bifida occulta is the mildest type of spina bifida. Spina bifida occulta is a small gap in the spine but no opening or sac on the back. The spinal cord and nerves are normal. The spina bifida occulta, also called hidden spina bifida. Alpha fetoprotein test usually performed in the second trimester. Increased level indicate spinal defects and chromosomal abnormality in the fetus. Increased level of AFP in adults is the sign of the liver cancer or ovarian cancer.